How does dysphagia impact breathing and speech in Parkinson's? Imagine trying to speak or breathe clearly when your muscles are not cooperating the way they used to. That's what happens with dysphagia in Parkinson's disease. It's a condition where swallowing becomes difficult because the muscles involved in swallowing and breathing don't work as smoothly. Parkinson's affects the brain's ability to control these muscles, especially those in the face, mouth, throat, and chest. This disruption can cause a chain reaction impacting both breathing and speech. When it comes to breathing, dysphagia can be quite serious. If food or liquids accidentally enter the airway instead of going down the esophagus, it's called aspiration. Sometimes this causes coughing or choking, but other times it happens silently without obvious signs. This silent aspiration can lead to aspiration pneumonia, which is an infection caused by inhaled food or liquids. People with Parkinson's often have trouble coordinating their swallowing with their breathing cycle. Normally, swallowing happens during a brief pause and exhalation, which helps protect the airway. But in Parkinson's, this timing can be off, and individuals might swallow at the wrong moment or inhale immediately after swallowing. This miscoordination increases the risk of food or liquids entering the airway. Additionally, muscles that lift the voice box or help clear the throat may not work well, further reducing airway protection. Weakness or rigidity in the muscles used for breathing can also make it harder to cough effectively, which is essential for clearing the airway if something goes wrong. Speech is also affected by dysphagia. Producing clear speech requires good breath support, precise control of the vocal cords, and smooth movements of the tongue, lips, and throat. Parkinson's can impair all these systems, leading to speech that sounds soft, monotone, or slurred. Muscle rigidity or weakness in the mouth and throat can make it difficult to pronounce words clearly, reducing speech volume and clarity. The characteristic masked face, which is common in Parkinson's, can make it harder to show emotions through speech, sometimes causing misunderstandings. Speech may also become slower or faster, and people often find it harder to find the right words, especially when tired or stressed. All these challenges are interconnected. Dysphagia in Parkinson's is not just about swallowing. It involves a complex disruption of muscle control and coordination that affects breathing and speech. This can lead to serious health issues like malnutrition, dehydration, and pneumonia, as well as social isolation because communication becomes more difficult. Managing these effects often involves working with speech-language pathologists who can teach strategies to improve swallowing safety and speech clarity. Techniques like strengthening exercises for the breathing muscles or voice therapy can help maintain function and improve quality of life. For example, exercises that focus on increasing the strength of the expiratory muscles can help with cough effectiveness, and specific voice therapies can help improve volume and clarity. In summary, dysphagia in Parkinson's disease impacts breathing by increasing the risk of aspiration and weakening airway protection, and it affects speech by reducing breath support and muscle control. Addressing these issues requires a comprehensive approach with medical professionals to help individuals live well and communicate effectively despite these challenges. Always remember, personalized medical advice from healthcare providers is essential to manage these symptoms safely and effectively.